So to protect that, you're going to need to make that X fan that you did with the wrist. So when you kind of lie them on the table and you had the nice supports. Okay? So for here, you're going to come down, figure out that area that it's going to be. So make sure you can go from top to bottom. You can lay it right down. And then you're just going to fan it out. Okay? The upper part is the thigh. So you can have a little bit wider of a fan up there for the narrow part at the bottom, because that's going to be on the smaller part of the bone. Okay. So this will be your fan that you can just lie out on the table. It's probably the easiest just to make. A little bit wider for the narrowing on the bottom. And then the middle is just to kind of hold the pieces down. So it's just a short piece that just overlaps on and through there. Okay?
So why this?
Yeah, just a little bit wider. I mean, you have a little bit area that you can cover onto the leg, because generally their thighs should be a little bit bigger than it would be on their calves. Okay, so from there you're going to find that bone on the inside of that leg. That's where that middle piece is going to go. And then the top part just holds in through here. Okay, you're going to notice that you have a little bit hanging over on the top, and that's what you're going to want, because you're going to do your first anchor here to hold it down. Then folding it over, now you have a little bit more stickier tape, which is just going to help hold the adhesive when you wrap around again. Okay, and then we can close on in through here. Okay, so now that top part would be anchored down. And then again, it's the exact same thing on the inside. So again, if that knee was to collapse in, now you have this restricting it if the ligament's damaged. Okay? So if you hold that down. All right, so now you're in through there. Now, if you'd like to add additional strips to help support again, you come from the top, you figure out where that X would meet on that fan, you pull in and around so it hits there, and then it just circles in the back. So if you turn a little bit, you can. So we went from the top of the thigh in and around to hit that joint line, and then it just circles to hit the back of the lower leg. Okay? Always making sure that it's hitting that cross right where that MCL would be. You can go from this side, again hitting that cross right where that MCL would be, to then come around to here. And that's just adding more X's, or it's to help supporting your fan. Okay? Once he has enough support there, your tensor can just help close it. And that's just making sure, because you do have that fan in on there, and you want to make sure that fingers or anything that can't get stuck underneath. So then,
so you put a tension.
So, just helps close it. Sometimes if they have neoprene sleeves or long compression pants, those can work too. But it's just going to look like this, starting at the bottom. And you're just encircling it. All the way up to the top. And you just put your fingers in. And this is just saving kind of the life of your tensor, because you will just be closing it with tape. So if you just put a little bit of Pro-Wrap on underneath, it'll just help make your tensors last a little bit longer. Yeah, no pins.
No pins?
Nope.
Okay.
So that way your athletes aren't going on there with any sharp objects and you don't have to worry about them coming off. And then, yeah, they're good to go. Okay, so we'll go through a little bit more. I just wanted you guys to see it just so that way you guys can have the visual to what we're doing. And then we'll let you guys all give it a try. Okay? So if you want to hop off, you can. So, yeah, we just have it here. That was in his starting position. The anchors, we did 3 on the top as well as on the lower body. And then again, you just always want to make sure that they do have a little bit of weight because you want a little bit of contraction because when he does start to walk and he does start to run, his muscles will contract. Here they went right on into the rotational strips. The fans, it's easier on you because you can just slide all down and then you know you have a nice sturdy factor to then put the rotations on top. So that's just a little bit more. And it just says, reminding you, make sure that you're always hitting on that cross part of the tibia, so right where that bone was, which we already pointed out. And you're not ever going over the patella. So you never want to cross the kneecap with this one. Again, we're always focusing on the inside of that knee joint. And then these are just all the rotations. And then, yeah. Okay, so we can give this a try if you guys want to. That's just kind of the breakdown of all the steps. But if you guys want to go in partners, then I'll just circle around and we'll go over that tape job, okay? So here, very similar to the tape job that we just did. The only difference is that our X is not going to go on the very back. Okay, so again, we're going to need that under wrap, that 1.5 adhesive tape, just like we used on the last tape job to make that X, and we're going to need that elastic tape for our anchors. Okay, exact same setup. You're going to stand up on that heel lift to contract your quads and your calves. You're going to use that heel and lace pad to help protect the tendons on the back of the knee. And then you're just going to anchor midway through the thigh and midway through the calf muscle belly. Okay? And then you can use that under wrap to help hold that heel and lace pads on. Okay, you're going to go in to do that X, or you can do the fan, either one if you put the fan on, just going from top to bottom. And then it's the same thing, you're using that elastic tape to do your support strips. So you'll go kind of from the side of the calf, which he kind of tucked it in over here, to then pull up to be on the side of the opposite thigh. So it kind of goes up and around. The more you can kind of start from the front to wrap around to the back and get around, that's just more tape adhesive that you're having, so it can help stick a little bit more. Okay, once you get all that covered in, again, you're going to need the amount of strips depending on the forces or kind of the weight and size of the individual. Once you are done, you'll wrap your closing strips again just to help anchor it from the top and the bottom. And then here will be really important because remember we're keeping our knee slightly bent. So you're going to have a larger area in the back of your knee. So then you'll have to wrap it up so then it cannot get stuck. And that's what he's just doing there. Because you'll notice when you start taping your partner, you'll have kind of like a little hole between the tape and the inside of your knee. Okay? And then that's that tape job. So if you guys want to switch partners, we can go over that one. It is very similar to the last one that we just did. Or would you guys like a demonstration first? Yep.
Except I have a question. When
Yes.
you're talking about like after the fan and then they do the other like X or whatever.
Yes.
You said from the bottom to the top, does it matter?
No.
Okay.
It's just you're kind of wrapping in around.
Gotcha.
In the photo, what kind of tape are they using to do the X's? Is that
So What they are using is kind of, the white tape is going to be the cheapest. It's about $2 to $3 a roll. This is about $5 to $6. And what it is it's kind of a thick, like strong, sturdy tape, which I can pass around. And when you're using this, you just have to basically pull it as hard as you absolutely can, because you have to take out all of the elastic. So in the pictures here, they're showing an elastic tape with all the tension pulled out. The white tape is going to be probably the most cost effective, and it works the exact same thing. Just the pictures for whatever reason. Yeah, so this is just that stretchy tape, and then you just have to make sure that you really pull it, and then you can use it. And it comes anywhere from this size up to 3 inches. So the white tape, if you stock your med kits with that, you'll probably get the most use out of all of it, and then you can use it just for absolutely everything. Mm-hmm.
So, just a question.
Yes, absolutely.
So, anchor, same way.
Yes.
Friction pad.
Yes.
And then when does this one go in?
So that is just the supports that they just wrap in. So they just do the first one just to help the extension, and then they go in through the support. That would be your fan. So by doing your fan, you're getting a little bit bigger, a little bit more support. So that's just lying your fan straight down, and then it's your support strips.
Oh, straight up and down. Because you want to prevent that, right? Okay.
So by doing your fan, that's just, instead of having one really skinny one, you're now getting a broader one, and you're getting 5 layers instead of the 1.
Oh, so you do that one, and then you go crisscross.
And then you do this course.
Straight around. Okay.
Yeah.
Excellent. As long as you understand the principle. Well, yeah, you can almost even screw up a little bit as long as you get the idea, right?
Yeah.
You know what I mean? As long as you get that X.
Pretty much, yeah. So the first one, yeah, that strip that he was just asking about, that there's just the one strip from top to bottom, that's basically your fan. So you can do straight one, or you can use a fan, which is 5 layers deep, covers a little bit more instead of just one straight through. So it's just a little bit stronger. And then your supports.
The one strap is stronger?
No, the fan would be stronger. Fan, you're getting like 5 layers deep, and you're getting a little bit kind of broader adhesive versus just one straight strip. But it would have to be very, very anchored on down and not allow any kind of give. But
But if it's a minor hyperextension or whatever, hey? Minor?
like kind of take the arm out of the shirt, or I'm going to need basically from the collarbone to the bottom. So if any of the males, sorry. So I'll let you guys figure that out. Yeah, you should actually probably be able to work if you even want to. I don't know if you do, but you can work. Yeah, we can make it work. Yeah. So we're all in. Okay, so the next one we're going to do is the AC tape job. So that's going to the AC. So this is going to be where your collarbone is going to attach out to your shoulder blade, kind of in through there. So if you ever fall and if anyone has ever, like, you separated your shoulder or anything like that, that's going to be to help, again, to help protect that ligament that would be damaged. If it's completely broken, we can't really do much for this. But, so I'm going to need you just to take your, we'll go through this quick. Yes, sweater off. So, this one we're going to use a little bit of a Hypafix. So that's something new probably that you guys are going to use. And the Leuco tape, which is going to be very similar to the white tape non-elastic that you guys used. It just has 0 give and it's a little bit stickier. But that's what we're going to be using for this tape job. Okay, so what you're going to do first is you just have to get your anchors down. So as always, you're always going to check the skin to make sure that you have no cuts or abrasions, anything like that. You can check the sensitivity, make sure they have no neurological symptoms. You're first going to do it down on the deltoid tubercle. So that would be where the roundness of the shoulder kind of stops. So where all of their deltoid would insert. So you just go sideways. It's going to be in and about here. So you're going to use, first you're going to take your spray, apply it all over the front and the back so it's nice and sticky. Let it dry. You're then going to take your Hypafix and it goes directly on the skin. So here we'll kind of find the roundness of that shoulder. We'll put the first one down. And Hypafix can be bought in about a 1.5 inch, and it goes all the way up to a 5-inch tape band. So whatever you have, you might have to make a couple layers up. Because again, the more support or more anchors that you have directly on the skin, the more it will stick and help the tape stick on. Okay, so now the next one we want to go is directly over that AC joint. For some of you, you'll have a little prominent bump, and that's directly where the clavicle would sit. Especially if it's injured and might kind of stick up, you might have a little bit more of a bump. If you can't quite find it, if you feel it's kind of on the front, coming in through here, you should be able to kind of feel that bump. It's not too crazy, so that's where we're going to put our first band down. We're going to go up just a little higher. Okay, so now we're going to have our anchors. We're right over top of that bump, and we're right at the bottom of that roundness, the deltoid in our shoulder. Okay? So now we're going to have to get our patient set up. So you're going to ask the individual to basically hold onto their elbow and kind of hold it up. That's going to kind of close off that space. It's going to help hold it. So then when you're taping it, it shouldn't feel like it drops all the way down. Okay? So I'm going to get you just kind of nice and under. Good. Get them in good posture. Fantastic. So we're going to use that Leuco tape. This tape you will have to cut with scissors. It's not really rippable. You'll kind of figure out from the bottom there up to the top.
Is that stuff stretchy?
No. So this is probably your strongest tape that you can buy. It has the most minimal. So directly on, kind of in through there. Once it's there, you're going to pull up. So again, try and pull that shoulder back up height, kind of to how she's holding it. Okay, we'll do a couple strips. Again, fan it on the bottom. And you'll always want to go up to about that same spot that it is on the top.
How common is this injury?
Fairly common.
Really?
Yeah, so more or less when people fall with their arms out straight, something's going to have to give. Either the shoulder kind of pops up or that kind of goes. So, and just keep pulling it up.
A lot of volleyball players?
I wouldn't say it's so much like basketball will get if they kind of fall down, or any like contact, or hockey, anything like that. Anything that has that potential to kind of fall. It's going to be your biggest. Or other ones are if you fall directly on it. So we'll say more of a direct trauma. Okay, so now that you have done the bottom, you're going to add a little bit of support kind of coming from the front to the back. So this is going to kind of pull that clavicle back in. If it is loose, it's either going to stick up or kind of stick forward. So here you're going to go from the very top, kind of along that anchor that you had, and run it back. Okay, so you're going to start at the front, just kind of below where the collarbone or clavicle would be, pulling it backwards to the back to stick on that hypofix that you'd have. Okay, once you kind of let down, if everything's holding, that could be okay. If it doesn't feel like it's still not enough support, put the patient back to where she was. Really hold it up. You can, same sort of thing as that hyperextension that we just talked about. Get this off. Right underneath that. And again, just really try and hold that arm up and then pull it. Get that support. Once the athlete feels like it is sturdy enough, you'll take the hypofix and go directly on over top, and that's just anchoring it down. In basketball, fortunately, if you ever kind of have an AC injury, probably going to limit any overhead motion. So like when that's going to come up and that's going to jam it. So that's where you're going to get your most. But if you can kind of get them taped up, if it's more of an outside shoot or anything like that, and they don't need to go up as high, you might be able to get away with it. But pretty much they're mostly going to be only good for defense, because anything overhead, the tape's not going to be able to really support a whole lot because you are coming up. So any kind of shooting. It's kind of getting that drop, yeah. And that'll be it. And like I said, always the more support strips, if you go wide out, come in, or the more you kind of pull front to back, it's just going to be stronger. Okay, so the next one we're going to do is for the shin splints. So in the bottom of your lower leg, you have 2 bones that run out kind of side by side. Inside there's a membrane that can get irritated. One of the ways, either if it's tight, if it's pulling, or a lot of new like running, kind of the forces acting up can kind of irritate it. So what we're going to do here is a little bit of support for that area inside the 2 bones, just to kind of help with any forces running up through the leg or any tightness or any pain. We're just going to add a way to compress that area, okay?
Is that connected to bone?
Yes, so it runs right in the middle, okay? So for shin splints and overall to kind of treat the pain, you're going to help compress those 2 bones a little bit together just to help with that. Here you're going to tape with white tape, and you're going to go directly onto the skin. So you just need your tape and you just need your spray. Okay? So you're going to do an anchor at the top of kind of where the pain is and at the bottom. So that's going to be your top 2, and you're going to use just, again, strictly that white tape, so make sure that they have that calf contracted. Then what you're going to do, you're going to add 2 just plain strips down either side of the leg. So that's what they have, just kind of on the inside and the outside. And it's just another surface area to help the tape stick to it to make it a little bit more adhesive, okay? So now you're going to go in and you're going to do your actual support strips to help pull those areas together. So what they are doing is they are circling the back of the calf, and then they are coming to the front and pulling up. And then the other one goes in the opposite direction. And then the one on top, you'd go to, again, always covering half of the tape. So you start halfway through the bottom piece and you'd work your way up, and you just continue the entire width all the way up to the top of the calf. And through kind of those crisscrossing, you're pulling the 2 bones together to help support it. Okay? Once you're done there, you can just do a quick close to make sure that all the tape ends stay together. Their sock can go directly on over top of it just to help as well. Okay, so I'll get you to help out in through here. So if you want to stand on up. Yes, please. And your sock off as well. So if you want to, we'll face that way just so everyone can see. So here, and you're going to come up. You're always going to check the skin to make sure that you have no irritations. If you get him to point to where the painful area is, most likely shin splints is going to be the bottom 2/3 along the inside. It's generally where people are complaining. If you are having to go right down to the bottom, you shouldn't. You could put your heel and lace pad, but you're going to stop most likely about there to there. Okay? So you'll check the skin, make sure we have no cuts. You can check his sensation, sharp, dull, anything like that. You're then going to spray. Make sure you're covering all the areas in. And then you would go directly into your zinc oxide. Okay? I'm going to use the Pro Wrap just to help save his legs. So normally you would go directly on over top. Okay. So you're going to limit your area. So you're going to put your anchors right through the top. These ones just have to go on nice and light. And then at the bottom. Okay, you're just going to add a little bit more taping surface. So right on the top. You just go down. And then one just on the inside. Okay, and again, that's just increasing the surface area that you can put tape on tape. Okay, so from there, you're always going to start a little bit higher, so you'll go about here, wrap around the back of the calf, come around to the front, and then you're going to pull in. And then it will stick just to that tape on the outside. Alternating onto the other one. Again, you want to make sure that you're at least halfway through. Yeah. Going around, coming back up, and hitting that outside tape there. Okay, you'll continue it all the way out. If you ever get where you kind of get a window or where you can see down to the skin, that's fine. Leave the tape where it is and just redo it and make sure you cover that. So it's just going to mean that your angles were just a little bit off. And you'll notice when you're here, you always start kind of high and you go around low. And you're going to learn the more you kind of tape, the angles that you have to get, they'll kind of have to start to change. As the calf starts getting thicker, you'll have to go around at a different angle and you'll just start to learn. Generally, the higher up you go, it's not quite so much of a angle when you're going around, whereas at the bottom you're almost going like down and back up. Okay, always make sure that you're not going past your anchors. So here we'll go just pretty similar to how the first one went on. Okay, so now you've got top to bottom, and then you're just going to compress, or sorry, just close it off by just going around in a complete circle. And then one at the bottom. And again, these ones are just to close it so you don't have to feel like you pull really hard. Okay. Now, if that person contracted their quad enough, so if they kind of leaned in, you'd get a nice contraction. You know you're not going to go through. And then hopefully that they can contract and they're not going to get too tight. Once again, if you need more support or if it is a bigger individual and you're worried that, like if it's a large calf, you might need to circle it twice because then you're just twice the thickness and less likely to rip right through. Okay? So then you just continue again, starting at the bottom, wrapping around, and then coming back high up to here. Okay? And then just your straight shark down the middle like how you did. Or another thing, you can just rip piece by piece, and it generally comes off pretty easy because you can see all the starts and ends. Okay? So once they're done, you always want to test them. You'll start to learn if you kind of went too tight or not. If it ever gets to be the point where after they kind of warm up or after they start getting more blood flow into their muscles will expand a little bit more because they obviously have more blood in them. If you need to loosen a little bit, you can either do a slight cut just kind of down the side just to relieve some tension and then just retape it again, not quite so tight. Don't worry that you have to take the entire thing off. More or less it's going to be kind of tightness in through here, not all the way down.
So cut it and then retape it over top.
Yeah, so it would just look, if you kind of take, like, oh, I just need a little bit more space, you're just going to go, and you're like, okay, how does that feel? Oh, that feels better. And then you just have to make sure that you go over that again and just kind of add that support. Yeah. So, okay. And then they're good to go. So I'll let you guys give that one just to kind of play around. If you don't, like, kind of go top to bottom, get used to the different angles that you'll have. Okay? And you guys can, I'll let you guys use the Pro Wrap for underneath. I will adjust onto your blisters. I don't have the slides, but I can talk about that.
Yeah.
Yeah, so blisters are common ones you're going to have in your feet. It's probably going to be the most, whatever it is. If it is big and if it's not like right recent, what you're going to want to do is you're going to want to somehow drain it. Okay? Yeah, so, but in order to do that, you have to make sure that everything is 100% sterile. So you have to make sure that the surface that you're touching is completely sterile. You want to make sure your hands and your gloves are completely sterile. You want to make sure whatever you're using, whether it's a small needle or if you have, I'm going to guess you guys are going to have kind of like a little lancer, I believe they're called, or anything, like to cut it. More or less you're going to have a pin that's going to be, has to be completely sterile. Okay? So now that everything is completely clean, you're wearing your gloves so then your hands are clean. You're going to get the individual to sit down and you're going to go in towards the side. So kind of if the blister was up, you'll go in at the side. Just a slight pop. Again, we have to keep everything sterile. So like a sterile gauze or a sterile Band-Aid that you will have. Sterile gauze will be best. Just you'll apply constant pressure to try and get that blister to be completely drained. Okay, so that way you can kind of relieve that pressure. As long as it's not right acute. So that's if it's still intact. If the blister has popped, the rule of thumb is if it's still, like if the skin is ripping off, if it is within 50% still attached, just leave it there. Put it back down. If you want to clean it, like with soap and water, like a cinder suds, which would come from the can. It's just like sterile soap and water into there. You can clean that, but leave it on. If it's more than 50%, you'll take sterile scissors and you can snip it, just so it doesn't further rip.
As soon as like, does that make it sterile?
That's soap and water. Yep, so that can help clean it up. And then if you want to use like a polysporin or anything or an antiseptic, they're a little bit, I guess they're not quite as harsh as if you took like straight rubbing alcohol or alcohol wipe onto it. You're going to probably cause more harm and you're just going to kill everything else. So nowadays there's a whole lot more germicides or polysporin or the cinder suds that are safer and they're nicer on the kids that will do just as good job. Yeah. Okay. So that's if the blister was intact and you need to pop it, or if it was ripped open, or if it was not. So now that you have done that all completely clean, if you have, that's when you can use the second skin. So they are like a blue kind of sticky like gel that comes in like a circle. You can put that second skin on and then cover it up with a Band-Aid. So the Band-Aid can be if you have like a non-adherent pad, or it can be just a straight Band-Aid that you're going to put on the skin. Okay, anything to hold that second skin down and to cover the open wound from the rest of the world. So that's how you're going to get that. So you've dealt with the blister, you've cleaned it, and now it's protected with a Band-Aid. If you want to use that Hypafix, you can put that directly on over top. So now that you've protected that blister, you want to kind of take off any pressure that's going to come from rubbing. So that's when you're going to use your donut pad. Any kind of really light foam can work. Here I have about 5 heel and lace pads. So you're going to have these in your kit anyways from all your tape jobs or for your ankles. So I did about a layer of 5, and you can cut to however big you're going to need. Now you want to cut that donut, so you're going to just kind of fold it in half and cut that donut out. So however big it's going to be. So as long as your blister is within that size, if it needs to be bigger, it can be bigger. And from there, you're just going to lay that on top, over top of your Band-Aid. And then now you're treating any of the pain or the pressure that's going to come from that touching that blister. Once that's on, Hypafix or the elastic tape, just straight wrap it on and then it's going to stay.
What's the Hypafix?
Hypafix. Hypafix. Yep. So, when you guys want to just come lie down on the table, I'll give you a quick visual. I just need the back of a heel. Okay. So, just going to see if we have.
Yeah. Hey.
Yeah, why do they?
Yeah. Cheaters. It's just on film. Yes, they do. Jordan's legacy is
Okay. So lie down on your stomach.
I'll never wear a Chris Bosh jersey.
Okay, so, and I'm just gonna take off one shoe if that's okay.
Yeah.
So common are gonna be somewhere on the foot, so right now we'll do for the heel. So everything has to be clean because you're gonna open the wound. If you were to pop it, you would take, just kind of grab, we'll just pretend that this would have been your gauze. I didn't bring it down, I said no, we're doing it. So taking it, kind of holding it, and then you're just gonna squeeze it all out and try and get it down to as least amount of pressure as you can. If it is open already and it is less than 50%, you can use a little polysporin, clean it all up, make sure that it's nice and sterile, or cut it completely off. So here we will, let's see, if we used a Band-Aid, if it was nice and small and you could cover it with a Band-Aid, we'll just pretend that this would be. So now it is closed and it is sealed, however you're going to do it. You're going to take the donut pad that you had. If you made it out of whatever you need, just something to take away the pressure. Okay? So there you can just kind of drape it on the back, making sure that whatever the size of the blister fits within that donut. Okay? I'm going to use Hypafix just to help seal it on. Okay. So you're going to go down, get that Hypafix on. I probably wouldn't spray for this just because if you do happen to have anything that's open, it's going to start to sting, especially if it gets right in on that spot. Okay, so this is just helping to hold that donut pad on. Okay, you want to make sure it's nice and on. Make sure that you're getting at least half of that Hypafix kind of on the skin to really help hold it down.
It's still pretty good, eh?
Yeah, it is pretty good. This stuff and this are pretty good for most. And then it's just closing it off. So for me, I'll circle around the ankle. There's no real science to this. You don't need a whole lot of stretch. You just need to make sure that you're above it and get a lot of support around the heel because that's what's going to rub.
Is that
Just to help hold it on. Yep. So there I just did kind of like a loop, which you would have done in your ankle tape job, if you remember your heel locks. I'm just using, and I can even go directly over the heel, and then it's just ripped. And then that way, everything's on. You added that little bit of foam support just to help take the pressure off, and it's nice and sterile, nice and closed. That's just for blisters. Okay? Good. Any questions with that one? No? We'll kind of talk about the both. So the first one is the groin is kind of more so if the pain is on the inside. So if they kind of went straight and they pulled and they felt like there was a pull in through there. What you can do is you can wrap to add a little bit of compression to help kind of that muscles, as well as you're going to wrap to pull it across the hip. So then that way they shouldn't be able to open their leg to the kind of the painful spot that they were before. It's going to kind of help keep that closed. Okay? So I'm going to need a volunteer. We'll go directly over pants. So I just need someone standing up on top of the table. So this one, if you want to go up, the use of like a compression short is great because it helps holds the tensor on and kind of helps hold it in place. So generally what you're going to do is either if they have like little spandex or anything like that, or in like with Pride and Privacy that they're comfortable, they're going to go down into the minimal that they feel comfortable in. Okay? If you're having to tensor over the compression shorts, that's fine because then they're going to wear their basketball shorts on over top. Okay? So we're going to get you to stand on the tape once again. Okay? So here what you want to do is you want to get that calf and that quad kind of contracted, so you kind of want to lean in on that. You also are going to want to have their foot turn in. Okay? So that's by turning their foot in, you're already starting to bring their leg in and not letting it go out to the side. Okay? So for both of these tape jobs, they're on the heel, their heel is turned in. Okay? Somewhat can you turn and even just kind of face out that way so they can kind of see?
Sure.
Good. So your landmarks that you're going to do, you're going to start kind of in through the quad and you're going to go above their hips. So if you put your hands like on the hips where they kind of cave off and it's the stomach, you want the tensor to go that high. Okay? And what you're always going to be doing to keep that leg closed, you're going to pull from here in. So then you're pulling their leg closed, okay? So we'll start here. You're just going to take the tensor. You're going to go around. Just pause 1 second. I should have mentioned, if you are taping a male, what you're going to want to do is they're going to want to take a t-shirt or a cloth or something, hold it in the frontal of their region, and you're going to want everything moved to the opposite side. Their groin region, okay? Yes, you want to push the package to the side. The reason being, when you're groin wrapping, you're getting all the way up till their leg. And so you don't want to compress something in, more or less, okay? So when they take their t-shirt, they'll do it themselves, and then you have a t-shirt there, okay? I don't know if it's males and females working on opposite teams, but that's how it has to go. So you'll find here, you're going to kind of start in the upper part. You'll wrap around, pulling no more than about 50% tension on the wrap. Okay, you don't need to pull it out all the way, otherwise you're just going to kind of cut off circulation. Bring your foot in now. Fantastic. Okay, the next one you're going to come all the way up. Okay, now you're going to go around their hips. So landmark kind of where it is to the top part of their hips. Not a whole lot of tension here. Up around their back. So it does come up fairly high. Now, you want to pull their leg, pull their groin close. So here, you're pulling to then wrap around. Okay? Take off some of the slack, you don't need or slack to keep that around. You're going to go around and back up over again. So way up above their hips. Coming around and you're pulling. Okay? Depending on the length of the tensor, this is kind of one of the shorter groin wraps that are kind of the thicker ones. That's how they have groined. You can go around about 2 to 3 times. And then you're just going to end by wrapping the tensor around the leg. So here I went 2, and like I said, you could go 2 to 3. Just put your hand there. Once again, save your tensors. And just put the foam wrap just around. So keep your hands there, but I'm just going to go over top. Good. You're going to go all the way the width of the tensor. Yeah. And then, good. That's just the pro wrap. That's just under wrap. And then you're just going to tape on top of the pro wrap like normal. Put your hands off. Good. And like I said, that pro wrap just is the base layer. It doesn't have to be 100% on, but it's just preventing tape going directly onto your tensors and just helping it kind of save the longevity of it. Okay, so in that way they can kind of test and you can see, can you go all the way up? Does it help or does it feel like you have compression and feel like it's kind of pulling you in? And that's just how that one's going to go. So the thing to remember is you're going from the top of their hip and you're pulling their groin in, you're pulling their leg in.
There you go. Yep.
Yeah. So if you have to go to the defensive side, you could, yeah.
Yep.
Is there anything in there?
So, yeah. That's how that one's going to go. So I'll give you guys each a tensor if you'd like, and you guys can go through that. The metal clips, obviously, when you get them, just pinch them. You can throw them out. You're not going to want to put like a metal something sharp on any of the athletes anyway. So. So I'll let you guys go. Even just kind of get the use of like pulling around, kind of landmarking on the hips will be kind of key. Now we're just gonna vary that one a little bit, okay? So pretty much the same basics. Now what we're gonna do is we're gonna save, if you ever had a quad or hip flexors, they kind of run in through there. Either if athletes are getting tired and they're getting overused from running a lot, that's generally when these will start to get sore in basketball. Or if they kind of cut and pull back, that muscle is then going to get pulled. So we're helping to kind of protect any pain that you kind of feel in through here. So with this one, the hip flexor is going to pull it in. So now when you're crossing the hip, that's where your tension is going to be, because you want that tension to kind of help pull that leg up. Okay? So you're going to set up the exact same way that you did for the groin. Good. This one again, make sure you get that toe pointed inward. Get a little bit bent underneath. Good. Okay. So you want to make sure you're going that way. So you're going to start your tensor and you're going to go around. One more time, get it all the way up. Here's where your tension is being applied. So you'll go up. Make sure you landmark on their hips. Okay, you can kind of take some of the slack off here because you don't need to be pulling tight all the way around. It's not the groin wrap. So you'll come around, go around the leg. Again, add a little bit of compression. Get that pull as you come up. Over top of the hip bone. Coming down, some of your tension can come off. And then 2 to 3 will be best. Okay, it's just behind you if you can put your hand there. And then, good. Perfect. And we'll just go around the hips. Yeah. And then it's just, again, that elastic tape just to hold it in. So same thing, just pull here instead of, so now you're going leg and you're pulling up to hip. Here you went from hip and pulled down to leg. And then it should feel when the athlete then stands that it's not quite so heavy, their leg is not so heavy, it's kind of helping it pull up.